From the minute the alert is issued, the team assembles in the Provisional Level 2 Treasure Coast Trauma Center. Fire Rescue EMS brings a trauma patient either by air,
roll over patient,
or by rescue truck.
Hi, can you hear me? I'm Dr. J. What happened to you?
Nearly half of all trauma patients are from high-speed car accidents, and more than 90% of our patients are local Treasure Coast residents from Martin, St. Lucie, Indian River, and Okeechobee counties. Since the center opened May 1st, the team's treated on average 90 patients a month. That's double the estimated number of patients.
Within a few days, 3 or 4 patients that, had they come here 2-3 years ago, would have probably died. They would have not made the journey out to another level of care, to the trauma center. And so having this here, those people actually lived.
Get a blood pressure cuff, start an IV, guys. Give her a liter of saline, get her a gram of NSAID. Tell the CAT scan will be ready about 10 minutes for her.
Once in the door, the trauma surgeon is in charge. His first concern, getting your body working again. Leading the trauma surgical program is Dr. Danny Jazarevec, Dr. J.
As a trauma medical director and as a surgeon, as a chairman of the department, I guarantee that patients that come here for trauma or any surgical problem, at this point will get the best care by the best trained team of professionals that you can summon.
Dr. J served our country, gaining unparalleled experience as chief trauma surgeon for our military men and women in Iraq.
We did horrible injuries, obviously. These are injuries that you normally don't see in civilian world except in certain situations like mass casualty situations and bombings.
The team brings a new level of traumatic medicine to Lawnwood Regional Medical Center's Provisional Level 2 Treasure Coast Trauma Center. Surrounded by a team of 15 on-call surgeon specialists and 5 full-time trauma surgeons, including critical care surgeon Dr. Chris Schutz.
If someone has perforated bowel, dead stomach, anything that needs operations right now, we're trained to deal with and handle.
The ABCs of trauma: A, clear an airway; B, get the patient breathing; and C, circulation. Get blood flowing in the body and stop the external bleeding.
CT scan, head, neck, chest, abdomen, pelvis. Let's go.
The goal is to get each patient stabilized enough to get to radiology and imaging for a CAT scan in under 10 minutes.
She's got a fractured clavicle.
Okay.
See that?
Here the surgeons and trauma-certified team of nurses and medics determine if there's any broken bones, vessels, or internal bleeding.
Was she moving or?
Oh, yeah.
Awake?
Awake, but confused, combative.
Next, the trauma patient is rushed into the operating room to stop the internal bleeding. It all happens in under a half hour.
The patient is stable, we put them on the table, and we do laparoscopic trauma surgery, which obviously is associated with lesser stay, less pain, few little incisions rather than a big one. So that's just the modern approach to management of trauma, and we do it all the time.
Less pain and fewer incisions with a less invasive laparoscopic surgery that research shows improves patient recovery time. All trauma surgeries are performed in operating rooms at 84 degrees and up. Also a proven fact, trauma patients experience hypothermia faster and go into shock from cold air because of the severity of their injuries.
I would say there's some bleeding around the liver.
Once the internal bleeding is stopped, they stitch up the patient, and she's wheeled into the next stage of the trauma center, either the trauma intensive care unit for critical patients or Lawnwood's trauma neurosurgical care unit, the TNCU. Here, nurses focus on patients' recovery around the clock.
Good. Are you having any pain?
No, actually waiting on doctor to go home.
Good, that's excellent.
And unlike an ER, at a trauma center, the trauma surgeons stay with the patient from the moment they come through the doors, through surgery, then inpatient recovery and therapy.
We look after the patient from the resuscitation all the way through the rehabilitation of the patient to get them back into the community very quickly.
The highest level of care until the patient is able to walk out the door.
We're going to be one of the best in the state.
A new team taking care of our local community. The top-ranked Lawnwood Regional Medical Center and Heart Institute is now even more advanced with the Treasure Coast Trauma Center Provisional Level 2.
Oh, a huge difference. I mean, the big difference is the hospital's not just an emergency room. This is a trauma center. And as a trauma center, we have 24-hour availability of a lot of specialists that this hospital did not have before.
Everyone here with one goal.
We are saving lives. There's no question, we are saving lives.